So what exactly is Alcian Blue? Let's break this down. The first key word here is cationic. All that means is that the dye molecule has a positive electrical charge. And that positive charge, it's the whole secret behind how this stain works, which we'll get to in just a second. Then there's copper phthalocyanine. It sounds complicated, but that just describes the dye's chemical structure. It's this big, flat molecule with a copper ion right in the middle, and that's what gives it that incredibly vibrant blue color. Now, what's its job? It's used to find two specific things in our tissue: acidic mucopolysaccharides, which you might also hear called glycosaminoglycans, or GAGs, and acidic mucins. These are basically complex sugars that are key parts of mucus and connective tissue. And whether they're there, or not there, or in the wrong place, well, that can be a huge clue for a diagnosis.
This diagram here shows us exactly where this stain really shines. Let's look at the anatomical targets. First, you've got the respiratory epithelium. The stain highlights the mucins made by goblet cells, which are crucial for trapping dust and junk in our airways. Second, in the gastrointestinal tract, all the way from the esophagus down to the colon, it helps us identify normal mucus-producing cells. But, and this is the important part, it's also used to spot mucin-producing tumors, which can tell a pathologist exactly what kind of cancer they're looking at. And finally, in connective tissue, the stain lights up cartilage, specifically those glycosaminoglycans that make cartilage so tough and flexible. The big takeaway, the pathology alert here, is that Alcian Blue is a go-to stain for identifying mucinous adenocarcinomas. These are cancers that produce a ton of mucin, and this stain makes that mucin pop, confirming the diagnosis.
So how does the dye actually stick to the tissue? Well, it all comes down to a basic chemistry principle: electrostatic attraction. You can just think of it like a molecular magnet. Let's walk through these 3 steps. In step 1, the components, you have your 2 main players, the positively charged Alcian Blue dye floating around, and in the tissue, you have your negatively charged acidic mucins. These mucins are loaded with negative charges. In step 2, the attraction, it's just simple physics. Opposites attract, right? The positive dye is pulled right towards those negative spots on the mucin. This leads us to step 3, the bond. The dye doesn't just hang out nearby, it forms a real chemical connection called a salt linkage, which is a type of ionic bond. Now the dye is locked onto the tissue. And the really cool part is, the intensity of that final blue color is directly related to how much acidic mucin is there. A pale blue means a little bit, a deep, rich blue means a whole lot.
All right, let's get into a slightly more advanced but incredibly powerful idea: using pH to control exactly what we're staining. By tweaking the acidity of our staining solution, we can pick and choose which types of acidic mucins we want to see. Think of the pH as a kind of chemical filter. So, at a standard pH of 2.5, which is just weakly acidic, you get what we call broad-spectrum staining. At this level, both carboxylated mucins and the more strongly acidic sulfated mucins are negatively charged, so they both grab onto the dye. This is your general-purpose setting. But what if you need to be more specific? Well, if you lower the pH to 1.0, the solution gets much more acidic. This actually neutralizes the weaker charges on the carboxylated mucins, so they won't stain anymore. Only the strongly acidic sulfated mucins stay charged and turn blue. This lets us tell the two apart. And if we need to be really specific, we can drop the pH all the way down to 0.5. At this super high acidity, only the most strongly charged sulfated mucins will stain. It's an amazing way to fine-tune the stain for really complex diagnostics and research.
Okay, so we've got a good handle on the theory. Now let's get practical. We're shifting from the why to the how. This next part is a complete step-by-step guide to the whole staining workflow, taking us right from the initial tissue sample all the way to that final slide, ready for the microscope. You know, before a single drop of dye even hits that slide, the success of your stain is pretty much already decided by these 4 crucial pre-analytical steps. Getting these right is absolutely essential. First up is fixation, usually with 10% neutral buffered formalin. This preserves the tissue structure and stops it from breaking down. Bad fixation means bad staining, simple as that. Second is processing. This is where we dehydrate the tissue, clear it, and then embed it in paraffin wax so we can cut it. Third is sectioning. We use a microtome to cut that wax block into super thin slices, usually about 3 to 5 micrometers thick. Too thick and you can't see anything clearly. Too thin and there's nothing to stain. And finally, adhesion. The acidic solutions we use can actually make the tissue float off the slide, so it's mandatory to use special coated slides that hold on tight. Oh, and here's a critical alert. Make sure all your glassware is perfectly clean. Even a tiny bit of leftover soap can mess up the pH and ruin your entire batch. Let's walk through the standard staining protocol, step by step.
We kick things off with deparaffinization, which takes about 5 to 10 minutes. This is where we use xylene to dissolve the wax, then alcohols to remove the xylene, and finally bring the slide into water. This rehydrates the tissue so our water-based dye can get in. Next up is the main event, the Alcian Blue staining. The slides sit in a 1% Alcian Blue solution, carefully buffered to a pH of 2.5 for a full 30 minutes. This gives the dye plenty of time to bind. After that, we have a quick but important rinse in distilled water for a couple of minutes to wash off any extra unbound dye. Then comes the counterstain. We use nuclear fast red for about 1 to 3 minutes. This stains the cell nuclei red, which gives us some much-needed context and contrast against the blue. After the counterstain, there's a final wash in tap water for another couple of minutes. And the last step is mounting. We have to dehydrate the slide all over again, clear it with xylene, and then carefully place a cover slip on top with a mounting medium. This protects the tissue and makes it perfect for viewing under the microscope.
Okay, we know the how, so let's talk about how to do it safely. Following the right safety procedures isn't just about getting a good stain, it's about protecting yourself and everyone you work with. This section on safety and reagent handling is every bit as important as the staining itself.
This table breaks down what you need to know about our key chemicals. First, Alcian Blue itself has low toxicity, but you still have to be careful. You want to avoid breathing it in or getting it on your skin. The powder form is especially messy and can get everywhere, so weigh it out carefully. Next is nuclear fast red. It's classified as an irritant, which means it can cause some inflammation if it gets on your skin or in your eyes, so standard precautions like gloves and glasses are a must. And finally, we have xylene. This one is in a totally different league. It has high toxicity, it's a known neurotoxin, and it's highly flammable. Because of that, the rule for handling it is absolute. You must only use xylene inside a certified chemical fume hood. No exceptions.
So to sum it up, these are the mandatory, non-negotiable safety rules for this procedure. Number 1, a fume hood. It's required for any step that uses volatile solvents like xylene. This is your first and best line of defense. Number 2, standard personal protective equipment, or PPE, is mandatory. That means gloves, a lab coat, and safety glasses at all times. And number 3, disposal. All your chemical waste and biological materials have to be disposed of according to strict biomedical regulations. When it comes to lab safety, there are absolutely no shortcuts.
All right, we've prepped our sample, we've stained it safely, and now comes the most important part, the analysis. This section is all about interpretation and clinical application, how to actually read the slide, understand what you're seeing, and turn those visual patterns into a meaningful diagnosis.
This image right here is a perfect example of what you're looking for. Let's take a closer look at what a really good stain should look like. The main targets, the acidic mucins, should show up as a really clear blue or turquoise color. This is the positive result we want to see. Now, for context, look at the nuclei. Thanks to that nuclear fast red counterstain, all the cell nuclei should be a nice red or pink. This helps us see the overall structure of the tissue. Finally, everything else, the background, should be pale or totally unstained. This sharp contrast between the blue, the red, and the pale background, that's the sign of a high-quality stain that you can interpret with confidence.
So, why does all this matter in a clinical setting? Let's look at the main uses. The number 1 application, by far, is in oncology for identifying mucinous tumors. Finding a lot of this blue-staining mucin can be the key piece of evidence that confirms the diagnosis of adenocarcinoma. The second application is for checking out normal tissue. Pathologists use this stain to see what the normal amount and location of mucin-producing cells should be, which helps them recognize when something is wrong. And third, it's incredibly useful for research. Like we talked about, by playing with the pH, researchers can use this stain to tell different types of mucins apart, which helps them study all kinds of diseases in amazing detail.
Look, no lab procedure is perfect, and even when you do everything right, sometimes things can still go wrong. That brings us to the super important topic of quality and troubleshooting. This is all about having systems in place to keep your results accurate and knowing how to fix the common problems that pop up.
This troubleshooting guide is basically your cheat sheet for fixing common mistakes. Let's run through it. First problem, weak or absent mucin staining. If the blue color is really faint or not there at all, the most likely cause is that the pH of your dye is off or the solution is just old. The fix? Check your pH to make sure it's at 2.5, and if you have any doubt, just make a fresh batch. What if you have an overstained background where everything has a blue tint? That's usually because you didn't rinse well enough. The fix is simple.
Just increase your wash times. If you see faded nuclei, where the red is really pale, it probably just means your nuclear fast red is weak, or you didn't leave it on long enough. So just increase the counterstain time. And finally, tissue detachment. If your tissue section starts to lift off the slide, it's because the acidic solution is weakening the adhesion. The action here is to make sure you are always using high-quality coated slides.
To make sure your results are always accurate and to meet standards like ISO 1589, you need a formal quality control process. It's not optional, it's mandatory, and it's a continuous cycle. Step 1 is running positive controls. With every single batch of slides, you have to include a slide from a tissue you know is positive for mucin, like colon. If that control doesn't stain right, the entire patient batch is no good. Step 2 is reagent verification. You have to check the pH of your Alcian Blue before you use it. Step 3 is data recording. You have to log everything: reagent lot numbers, dates, staining times. This gives you a complete audit trail. And step 4 is trend monitoring. Every so often, you should look back at your old control slides to see if the staining quality is slowly getting worse over time. This whole cycle is what gives you reliable results day in and day out.
You know, documentation is the absolute backbone of quality and safety in the lab. On the left here, you can see a typical laboratory staining log. Notice it has columns for the date, the lot numbers, the control results, and the tech's initials. This is traceability. If there's ever a problem, you can trace it right back to the source. And this log directly supports what's on the right. First, staff competency. This paperwork proves that people are performing the stain correctly. And second, risk mitigation. Good documentation is one of your best defenses against diagnostic errors. If a result is ever questioned, these logs prove the test was done right under controlled conditions.
We have covered a ton of ground here, from the tiny molecular bonds all the way up to the big picture of international compliance. So, let's bring it all together and do a quick recap of the most important concepts from this explainer.
All right, here are the 5 key things to take away. First, the core mechanism. Alcian Blue is a positively charged dye that sticks to negatively charged mucins, kind of like a magnet. Second, the outcome. When it works, acidic mucins turn blue or turquoise, and the cell nuclei turn red. Third, specificity. Remember, pH is your control knob for telling different types of mucins apart. Fourth, compliance. To meet ISO 1589 standards, you need daily controls, lot tracking, and to follow your SOPs to the letter. And finally, the impact. This stain is absolutely critical for accurately diagnosing certain types of cancers and cartilage disorders.